So just for you to be aware of that. Then secondly, why are we doing this call? We are currently in the Health System Advocacy Partnership, where we focus as Wemos on financing for health, particularly in Kenya, Uganda, Zambia, Tanzania, Malawi. We work, for example, with AMREF and with ACHES, so that's also why they're on the call. And one of the things we do is that we develop knowledge products, infographics, fact sheets for people to help understand how finance for health works and aspects related to it. And our latest fact sheet on fiscal space is one example of this. So just for you to know, if you're interested in any of our knowledge products, you can find them on our knowledge platform. It's called Wemos Resources. So I opened it. You can see the URL here, wemosresources.org. So I'll post it in the chat box for you. And on here are all our knowledge products on human resources for health, finance for health, access to medicine. Should be quite easy to use if you go directly to fiscal space. Okay, so usually there's a video, but it's not working in my computer right now. You can see, for example, you can find our fact sheet on fiscal space here. So this is the one we will do a presentation about today. If I go back, there's also many others. For example, our infographic on universal health coverage and how we see it and how funding could be pooled. So you can see that one here. They're all for free. You can download them anytime. So feel free to use the tool. And then I will stop sharing my screen, and I will give it back to Miria so she can start with her presentation. She will do a presentation about max 30 minutes, and then afterwards we'll have a time to have a bit of a discussion, questions, anything. So feel free to write any questions in the chat box in the meantime, but I suggest if you want to ask your questions in person, save them to the end. Yep, and then I'll leave it up to Miria.
Okay, thank you, Renee. Hello, everybody. This is Miria from Wemos. Can you all see my screen? Is it shared? Okay. Very good. So let's start. So as Renee said in her introduction, at Wemos we created a fact sheet for the fiscal space for health and 4 ways to increase it, which you can find in our knowledge platform. And today I'm going to present the findings of our research and give a bit more information on fiscal space analysis and how we can use it in health advocacy. So as you can see, the learning objectives will be to explain the definitions and clarify any questions, to explain why it's important to do fiscal space analysis when we discuss health financing, and to see what kind of opportunities and challenges we can find in health financing when it comes to advocacy. I have the link here, but as Renee showed you, you can visit our Wemos resources and find the fact sheet quite easily. So let's start. First of all, when we talk about health financing, we need to define which are the sources of financing. I have divided them in 2 groups. The domestic budget, which is basically all the budget that the government has to allocate towards health, which comes from the overall tax revenue or taxes that are earmarked especially for health. It can come from income from natural resources such as oil and mineral activities in a country, as well as health insurance schemes. There is also the private budget that I include in the domestic budget of a country, which is the money that comes directly from the households, the out-of-pocket payments, as well as the private insurance that usually is from employers, and it includes those who are employed in the formal sector. The external budget is the one that comes outside a country, which can be in the form of grants, either they are added on the government budget or outside the government budget. And of course, there's also the case of external borrowing in the form of loans. So there we are. The definition of fiscal space is quite a mouthful. This is the IMF's definition that we have used. And it's the availability of budgetary room that allows a government to provide resources for a desired purpose without any prejudice to the sustainability of a government's financial position. So as you can see, this term is not health specific because fiscal space does not take into account what the additional budgetary room is intended to be spent on. And yeah, it does not have a specific sectoral focus. It refers to the overall government expenditure. However, there has been growing demand for a framework to analyze specifically the fiscal space that exists for the health sector in particular. So if we want to make the fiscal space definition a bit simpler, we can tell that it's the availability of funds and how flexible and free a government is to choose how to spend this money. And we will continue with discussing the fiscal space for health in particular. There we are. So a government, in order to expand, as we say, its fiscal space for health, can choose between different policy options, fiscal policy options. And this is depicted graphically by the fiscal space diamond, as it's called, the one that you can see on your screen, where we can expand in 4 different directions the space that we have. Namely, efficiency, foreign grants, borrowing, and domestic revenue. We will analyze one by one all these options. In general, we can see from research that governments with a higher fiscal space, so a higher availability to spend funds, they tend to have lower poverty rates. So there is a correlation there. And what is really important in increasing this fiscal space is the institutions and the governance. So we have seen that countries with more transparent and accountable budgetary processes tend to make spending choices that have stronger impact on poverty reduction and inequality reduction. And it all depends on the fiscal capacity, of course, which is the capacity of the government to actually increase its public spending on health in this case. And it depends on different factors that we're going to analyze. So one of the most important factors of the fiscal capacity of a government is the priority that, that is given to health in the resource allocation decisions. So as we can see here in the graph, let's imagine that the green area of the graph is the whole government budget, and then the blue area is the budget that is allocated to health. So it's very important in the fiscal capacity of the government how much prioritization the health takes within the government budget. And of course, the allocation of the budget is a highly politicized process because countries may have other competing needs, other sectors that they want to fund. So the question is whether the authorities can make the case for a greater share of the available funds to go toward the health sector. For example, can the Ministry of Health advocate to the Ministry of Finance for more budget for health? And can they prove that they use it well? These are all important questions that the fiscal space analysis can help to answer. The question is, though, that even if a government prioritizes health within its government budget, there is a challenge also to increase the fiscal space overall. So instead of only increasing the piece of the pie that goes to health, is to increase the pie overall, which you will see in the next graph. which brings us to the first policy option, which is the raising domestic revenue. As you can see, in this case, we want to expand the whole pie of the government budget. And how to do that? So there are different options to increase domestic revenue. A very important one is the tax policies and the reforms to capture revenue, either nationally by doing tax reforms in the national level, or internationally, which affects businesses, international businesses that operate in a country. Another option is to gain profits from state-owned enterprises and the natural resources that I discussed before. And also there's always the option to print basically more money, the expansion of money supply. Raising domestic revenue has, of course, its pros and cons. It makes a stronger fiscal contract with, between the government and the citizens, because the citizens will ask what they pay for. They can demand public return from their contributions to the public. It's free from debt-related risks and grant obligations, so there is national ownership of this extra revenue. It's sustainable, as it can be continued through the years, and depending on the policy that we are going to choose, a government can reduce poverty and inequality if domestic resource mobilization is done in a progressive way. And here comes also, this brings me to the cons, let's say, of these options, that depending on how you're going to raise your taxes, it can be progressive or regressive. So there's always the risk of regressivity depending on the tax policy that is going to be chosen. There is a risk of inflation if a government chooses to print more money. There is the challenge of taxing of a very low tax base in countries where there is a very large informal sector. And of course, we're talking about results in the long term. It's not a quick fix that will bring money quickly into the treasury. It can also affect international trade relations, because high taxes, international businesses can lead businesses to choose other countries to operate. And of course, any policy that is followed in taxation has also gender complications. It has been noticed that, for example, female-headed households tend to suffer more from high taxations, because usually women are in the lower income group. So if we move on in the next policy option, it's to improve the efficiency of the health sector. So as you can see in the graph, within the health budget of a government, there is an area that is wasted due to different reasons. It can be corruption, it can be absenteeism of health workers, you name it. So in order to gain from better efficiency and to reduce wastage, we need improved governance. Of course, this is sustainable. This is also something that we aim for the long term. It's not a quick fix as well, but it can also be multi-sectoral. It's free from debt-related risks, of course, because it's something that is happening within the country, but it requires capacity in the long term to plan and manage governance. Sometimes to bring in the private sector is presented as a quick fix, because the private sector, it can be considered more efficient, but there's no guarantee to that. And this is a big discussion when we talk about public-private partnerships in health, because it also entails risks. So yes, there is a question mark there. Then by borrowing, so by loans, A government can opt for more quickly available funds, which also are not tied to any agenda from donors. Also, they are tied to conditions by the lenders. An example for that at Wemos we have explored a lot is the GFF and how it has conditions for the health workforce salaries. When we're talking about debts, we need to discuss the debt sustainability of this option, because debt repayment can absorb public funds in the long term, and you can see that also in the graph where it's depicted visually. So in countries with in high debt distress, an option that can be discussed from the authorities is also the option of debt restructuring and debt relief, which can free up resources to be allocated to the social sector, so in health as well. And this brings me to the last option, which are the grants, which don't have the debt-related risks of borrowing. They are quickly available, but of course, they also come with risks. They are often tied to the donor's agenda. They can be earmarked, so they can not be addressed towards health system strengthening, but more into specific disease programs. And they are often unavailable for recurrent costs, like the health workforce salaries. There's also cases of unabsorbed funds and fragmentation and duplication, and this is a matter of governance in the country, but also of effectiveness between the donors. So the foreign grants are in two categories. Okay, now you see my screen. There are the off-budget, which are project-based, and this is an option that some donors go for to circumvent governments and fund directly their projects, usually either to avoid, to bypass government spending ceilings, or because they consider it a more efficient option. The on-budget grants, on the other hand, are added in the government budget. The risk for that, what is known as the fungibility of the foreign grants, is that there are cases where, because of an external grant coming in the health sector, the government can reduce its own investment in the health. So instead of adding up, the foreign grant replaces government budget allocation. So we talked before about how a government chooses, and if a government chooses freely or not, about how to use its fiscal space and its fiscal space for health in particular. However, there are factors that affect actors that affect these choices, and we have seen that there is an important role of the international financial institutions into that, especially the IMF and the World Bank. We have seen that via conditionality of the loans and policy advice, the IMF can place fiscal targets and constraints and austerity measures, wage bill ceilings or recruitment freezes for the health sector and the social sector in general, that will influence a government's choice of policy for expanding fiscal space. They also play a role as a gatekeeper in donor agreements, and they also can promote through their advice public-private partnerships or financial modalities such as the results-based financing. Sorry. So to analyze, fiscal space analysis is a tool to assess and predict the resources of that the government has available for the health sector. And I presented you the options that the government can has, but there are several tools to analyze this fiscal space. This is a framework that was proposed by the World Bank, and it's really aligned with the options that I described before. So if you can see here, we have, in this case, 5 different sources, because prioritization is added here as an option. And what is important to note is that the first three, which are the macroeconomic conditions, the prioritization, and the other potential resources for the health sector, they lie outside the domain of the health sector. They are linked to more to general macroeconomic policies. The other two, which are the efficiency gains and the foreign aid, lie within the health sector. So I wanted to highlight with that when we talk about fiscal space for health analysis, it's not only in the health sector alone. We need to see outside that in the more general macroeconomic environment. So the primary question that we want to answer doing a fiscal space analysis is that, given that we know the needs, that they are well defined, what are the prospects of a government to increase its spending for health in the short to medium term at least? So at the minimum, a fiscal space assessment needs to know the needs, the current factors that drive the needs, to analyze the potential for additional fiscal space under the policy options that I discussed before, and to discuss which in the end is the most viable option for increasing fiscal space for health and which are the obstacles. So this framework has the sources, the indicators, some examples of indicators, and then we can judge whether the perspective is limited, moderated, or good. I will give you an example to finish on the fiscal space analysis that we did for the case of Uganda using this framework. So these are all the sources of information that I used to analyze fiscal space for health, and especially for human resources for health in Uganda. And I have placed them in this table, and you can see the way of thinking. So first of all, when it comes to prioritization, we recognize the opportunities so that there is an increase in the health sector budget. We have recognized the bottlenecks. However, there are challenges when it comes to prioritizing health over other sectors. When we talk about macroeconomic conditions, so I link it with raising domestic revenue, we see the opportunities of historical growth, of an increase in GDP, of a growth forecasted due to the oil, but we also see the challenges, which are a low tax base, high illicit financial flows, high debt burden, and the question of the distribution of the oil revenues. Then we add here the other potential resources, which is the National Health Insurance Bill, and the challenge of having very low percentage of the population insured. Then when it comes to the foreground, we see the opportunity of an upward trend of the development assistance for health, and that there is a slight increase in the aid channel through the government and new modalities such as the GFF. We also recognize the challenges of high aid dependency, of the restrictions of grants towards, for example, health worker salaries, and questions about aid effectiveness. And then when it comes to efficiency, we see the opportunities that, for example, absenteeism is significantly reduced, that there are better health information system, but we also see the challenges of outdated staffing norms, of and still some inefficiencies in the health sector. So what I wanted to show with all this, that all these policy options, if we explore them separately, it gives entry points for advocacy to increase fiscal space for health and human resources for health in particular, as it was my example for Uganda. So this analysis, even though it's something that affects the health sector, it's important to be seen also outside of the health sector. And here is where good communication between CSOs working on the health sector, but also outside, for example, CSOs doing budget monitoring, is important. And this analysis can provide us with really strong messages for advocate for more resources and better use of the resources for health. So these are some references that I use. And I think I talked a lot already. So we will open the floor now for some questions that you may have. And to discuss maybe from your point of view, if you have experience with this kind of fiscal space analysis, examples of how to use it in advocacy in the national and the international level, and also in your context, which of all these policy options seems to be more relevant. So thank you very much. That's from my side. I'm going to leave the questions on the screen. Can I do that?
Yes. Yes. In the meanwhile, thank you very much, Mirja. I think you gave a very clear overview and nice presentation. Just in the meanwhile, if you would like to receive the presentation afterwards, we're going to try to upload it on our knowledge platform. But if you want to receive it directly, because we didn't do any registration for this webinar, I don't have all your email addresses, but you can send directly a message to me, and I will share the presentation with you.
Okay.
I'll put my email in the chat box. All right. If you have any questions, you can either write them in the chat box, or you can unmute yourself and use the microphone. Or if there are multiple people, you can raise your hand. I'll make sure everyone has the opportunity. Maybe nice to know is that there's also 2 other colleagues from our Finance for Health team in the call, Barbara Finig and Mariska Meurs, and they'll also be able to jump in if necessary. Well, oh, yeah. Philippa, please go ahead if you.
Okay, thank
Yeah,
you.
I can hear you.
So
Yeah.
much. Can you hear me? Thank you so much for your presentation. It's super helpful. I'm currently doing a piece of research on HIV financing in Africa for the Society for AIDS in Africa, which is going to go to ministers of health and presidents. And so, you know, for me, it's very interesting to learn about this in terms of how we can include the fiscal space discussion in that work. Do you can you because obviously I wouldn't have time to do all of the 55 member states of the African Union. Is there a central resource where people are doing fiscal space analysis for African Union member states? Is there some way that is there a collective database on this somewhere?
All right. Thank you, Philippa. Shall we take a couple of questions before we answer them? I also saw a question from Kim from Amre from the Health System Advocacy Partnership. She says, thank you for the clear presentation. My question is on sources for funding for health. As remittances from international migration are increasing, could this be another private/government source for more funding for health? All right, I see Bistra, yes, I will send you the presentation. Patrick Kadama from Achas, Uganda, I also see you raised your hand. Would you like to pose the question?
Yes. Can you hear me?
Yes, very well.
Very good. Thank you very much for the presentation. And I would also like to get the presentation sent to me. Just one question about this, the last slide, the penultimate slide, about the allocation to health. Did you say this was Uganda? And if it was Uganda, do you have the data that the allocation to health is increasing?
All right, thank you, Patrick, for the question. I also see a question from Mid popping up, and then I suggest I'll give the floor back to Mirja. Mid saying, I wonder where the current narrative of innovative funding is fitting into the fiscal framework, e.g. aid now being used to buy down loans as the Global Fund just announced for India, and other donors are flirting with it too. Yes, Mirja?
Okay. Can you hear me? Yes. So the first question about a collective database of fiscal space analysis from the African Union, I have not found yet such a database, I'm afraid. So I have found a lot of fiscal space analysis from the World Bank, that they also use this framework that I presented. One of the reports that I used are also in the presentations, in the references, so you can have a look. It's a bit older, but they keep on publishing this kind of analysis. But I have not found something for the whole African Union. I don't know if someone else from the call knows more about that. But from my side, that's all I know. Then we had a question from Kim about the remittances being a source for more funding. The thing is that whether these remittances are going to usually the remittances from immigrants, let's say, go back to the households, right? So they can increase they can provide the more income to the households to spend for health. But if the remittances are not going to the public health basket, then I don't see it as a source for more funding from health coming from the government. I don't know if I understood clearly the question, but if it's not put in increasing the pie, then I wouldn't consider it a source for increasing fiscal space for health. Then Patrick, you asked about the allocation for the health increasing. I have all the data. Of course, it has increased in a time frame of the last decade, let's say. In the last financial years, there has been a decrease indeed. Since last year, there was a 0.3 decrease in the budget allocation to health for Uganda. But if we see it, yes, in the last decade, there has been an increase, but I have all the data. And for all the participants, actually, all this is going to be published in a report that we are producing now between Wemos and HEST. So all this data will be publicly available also in our Wemos resources. So keep on looking at it. And then we had the question.
Just on that one, may I just come in here?
Mm-hmm.
I think we must be careful and whether we are talking in nominal or constant dollars. Situation for Uganda for that one. So let's look at the data again.
Mm-hmm. So
I can share some more information on this.
Yes, I was talking about percentages, so about allocation towards health
of nominal allocations.
Yes, but you're right. I mean, we should be more specific with that. But
as I said, 2010, the per capita funding of health in Uganda has been falling.
Mm-hmm. Since 2010.
Since 2010.
But in the allocation, I have seen, looking back to 2007, comparing to today, a slight increase with a decrease the last years. Of course, I couldn't put all the details in this presentation.
With nominal numbers, yes, there is an increase, but it's outstripped by population rise.
Increase, yes, that's right.
So inflation and population are eroding the gains from 93 to 2010. If you look at the chart, there is an analysis on this. We'll share it.
Okay, that would be great. And actually, this also shows how important it is to see all the macroeconomic factors when we discuss this matter. So, to see the GDP, to see the allocation related to the GDP, the allocation related to the government budget, the inflation, all these factors that should be included in such an analysis. So, thank you for that. And we still have the question about the innovative funding and if it's fitting into the fiscal framework. Yes, and that aid is now being used to buy down loans, as the Global Fund just announced for India. So, to be honest, I have not included that in my analysis of Uganda, but it's definitely a factor that it's worth looking at.
Yeah, this is mid. I can just. I'm just wondering because it is now put so much forward as the solution for a lot of gaps and so on. And besides the fact that there is very little evidence yet and no experience and not documented, I'm just wondering if we could use that, you know, if it would really increase the fiscal space or not. So I don't expect right away an answer, but
yeah.
Be an area to look at.
Definitely. No, thank you for that input. For sure, it's something to look at because it involves both aid and borrowing. Exactly.
Yeah.
All right. Thank you very much, Mit and Patrick, for your contributions and questions. I would like to suggest to do another round of questions. I see one in the chat box, but feel free to raise your hand if you also would like to ask another question through your microphone. Bistra from Children's Heart Link asks, well, first of all, thank you for the presentation. And she asks us if we can share examples of CSOs advocating for increased fiscal space successfully. I think I also just saw a hand from Simon Wright. Would you like to pose a question?
Thanks, Rena. Yes, thanks very much for this. It's really great that this is being focused on because it is really the big issue in building universal health coverage. We know that ODA can only pick up small parts of health services. It can make a big impact on small areas, but it cannot, in many cases, provide the recurrent funding for whole health systems. I just wondered what you thought about, we've been within the UHC 2030 movement, looking at the high-level meeting, we've been trying to get a very clear push that governments should be increasing domestic resources and increasing their fiscal space in order to do that, recognizing that that this is really the way to shift from out-of-pocket payments, which in many countries we know exceed kind of 5% of GDP, but government spending remains very low and in fact has gone down over the MDG era, because it appears that ODA coming in allows governments to move domestic resources to other areas of spend. So in least developed countries, the government spending on health has reduced over the last 15, 18 years. I'm just interested in kind of whether we should be trying to develop, we try to argue, and there's some WHO information that says 5% of GDP is a pretty good aim for every government. But of course, it's not realistic in the short term for many of the poorest governments. And whether we could be trying to push for some benchmarks for government spending in countries, whilst also then identifying the countries that even if they do absolutely everything they can, it will still be inadequate. And there are definitely countries like that. And therefore aid should be targeted to those countries and in ways that helps them to build a comprehensive health system, not the fragmented way that it often is given now. So just interested in your thoughts about international benchmarks.
All right, thank you, Simon and Bistra. I don't see any further questions now in the chat, or is there anyone else who would like to raise their hand, has a question? Oh, sorry, I just see one. I just see one from Mit. If time, two questions or more. I think we have some time. If remittances are not contributing to increased fiscal space because they're not flowing into public expenditure and rather private, would this also then apply for private funding, I assume? The challenge is probably to balance the various challenges linked to the various sources, ways to increase fiscal space, the importance given to, oh, sorry, the second question is the balance one. The challenge is probably the balance of the various challenges linked to the various sources, ways to increase fiscal space, and the importance given to each of them depends on the actor. For instance, the aid dependency challenges are focused on in the donor's current narrative. Are there any other actors we could target that shift a bit away from this narrative and value other aspects more? Thank you, Mit. I'm looking at my team now. I think, Miriam, would you like to answer some questions? And Mariska also had some suggestions. Mariska, would you like to start this time?
Okay, thank you, Renee. Can you hear me? Yep, okay. As to Bistra's question, I'm not so sure. Maybe Miriam knows of good examples, either successful or not. I wanted to go into also Simon's issue. And I must say that in our advocacy messages for the last years in relation to funding for UHC, we've actually been highlighting what we call the twin targets. So the 5% of GDP recommendation originally came from this task force on health financing, which combined it with a absolute number. And yeah, you could say it's kind of a benchmark. It hasn't been really used in that way. Both WHO and World Bank have also been quoting absolute numbers of minimum spending in relation either to the SDGs or to UHC. And we think they are important to keep in the picture, because not only is it not realistic for many countries to move to 5% of GDP in a short time frame, for a number of countries, even if they do allocate 5% of their GDP to health, it still results in a very low amount because the GDPs are so low. So yeah, from our perspective, it's important to highlight both the relative numbers, keep urging governments to prioritize health more, but also show these these absolute targets, and maybe they do push for international benchmarks, and keep pushing for ODA also to abide more by the aid effectiveness standards, even though, as you say, it is a small amount if you look at the totals, but it's still in a number of countries a very important contribution to health. So I'd like to leave it at that.
All right, thank you, Mariska. Mirja, would you like to address the other questions?
Okay, so one question was about examples of civil society organizations advocating for more fiscal space for health. So, and if we know any example, yeah, unsuccessful or not. So, I don't want to name one, but what I wanted to say on that is that any organization that asks from the government to invest more on health, or to invest more on health worker salaries, which can be from patients organizations to professional organizations and trade unions, they are basically advocating for that. The question is if we have the right argumentation to do that and the right analysis behind it. So yes, I mean that's a general answer, I know, but any organization that asks for better investment in health is actually advocating for more fiscal space for health. And then I need to read Mit's question again about the balance. Other actors we could target that shift a bit away from this narrative and value other aspects more. So outside the aid narrative. So outside the aid narrative, if I understand the question well, to increase fiscal space, there is also the advocacy for tax justice for countries. So apart from advocating for aid and more effective aid, we can advocate for the resources to stay where they belong. If we talk about, for example, illicit financial flows that leave countries due to tax evasion and tax avoidance from multinationals that operate in third countries and not in their country of origin, then yes, I can see that as a promising area of advocacy for increasing fiscal space. And this will bring us to the option of domestic resource mobilization by keeping these resources in the country instead of seeing them fleeing into tax havens, for example.
Okay. Thank you, Maria, again. I see one more question from Philippa from Accountability International. And Simon, your hand is still raised. I'm not sure if you have a follow-up question or you just remain to raise your hand. Ah, yeah, okay. Philippa, go ahead.
All right. Yeah, I think mine is less of a question, and and if somebody has something to add to it or to correct me, I'd be welcome to that. I work with the African Union Commission on the scorecard on domestic financing for health, and one of the things that I've learned in that space, because Accountability International does a lot of accountability frameworks and scorecards and kind of following up on commitments, and one of the things I've learned there is, and through all the time that we've worked on kind of holding governments to account to commitments, is that the simplistic commitment, like for example the Abuja 15%, where African countries committed to 50% of the budget going to health, or a percentage of GDP or whatever, those standalone commitments and then the measurements against them don't really make a lot of sense. And I support what my colleague from Uganda was saying, that we need to see, and you're also saying, is that we need to see everything in relation to each other and contextually, because we've actually found that some of the health advocates in Africa stay stuck on the 15%, the Abuja 15%. And it doesn't really make sense, because it's going to cost a lot more to get, universal health care to an individual in a country like Chad, where you've got low infrastructure and a large geographic area to cover, and they currently only have like 3 tracks, than it will, for example, in a country like, Swaziland, which is tiny, has great infrastructure, and is manufacturing their own transport, for example. So I think that these kind of simplistic measurements and commitments, we should be very aware of them as activists. And I think that one of the other things is, in terms of advocacy, I think more of us should be talking about the Global Tax Authority. I think not only about how individuals are not paying taxes in developing countries, and with the kind of understanding that, but I'm paying it back in Belgium, for example. I do think that a global watchdog is something we should all be fighting for. That's it from me. I'd love feedback or other people's thoughts.
Thank you very much, Philippa. I really like the idea of a global watchdog. I think very necessary. I don't know if there are any comments to this. Feel free. We have some time left, so feel free to make remarks or comments. In the meantime, I would like to remind you that if you would like to have the slides, we don't have any registration, so please send an email to me, or I put my email on the screen, or leave your email in the chat box, or you can find it online at our research platform. I see another question from Mit. On the 5% GDP discussion, do we have information on the volatility of GDP and thus the reliability of stable income from the public budget? In absolute figures, sufficient compared to the minimum WHO target expenditure on public health per inhabitant? Are there any other comments or questions, remarks, new ideas? Anyone? Miria, would you like to have a look at the final question? Oh, sorry, I see Iburo Nelson. Do you have a question for us?
No, not at the moment. I joined late, so
All right, no problem. But I heard some background noises, so then I mute you. And thank you. And Mariska, do you have some remarks or comments? Sorry, Miria will answer the questions then in the end.
Yeah, just while Miria is reading the question, I wanted to welcome Philippa's suggestion. I think that is very, very to the point. I think in the discussions and the big emphasis that's being placed on domestic resource mobilization for the last few years, the burden is put very much on the shoulders of national governments. And yes, of course, many should be doing much more, but we should indeed not forget about responsibilities of global level actors and doing more about global tax justice. So something like a global tax authority or a global watchdog in this regard, sounds like a very good idea to me.
All right, thank you, Mariska. Before we close up, Miria, would you like to?
Hi. So I'm reading Mit's question about the volatility of GDP and how reliable is a stable income from the public budget. Definitely is worth considering, actually, because yes, of course, if there are really peaks and lows of the GDP, this will affect the budget that you have for health. But I think in this discussion of the volatility of the GDP, it comes handy also the absolute target for health expenditure. So yes, indeed, we have this 5% GDP discussion, but this is accompanied by absolute targets set.
All right. All right, thank you, Miria. And then I'll take the opportunity to answer Mit's very last question she posed underneath. We were very happy to organize this webinar today. If anyone thinks there's a platform or organization who would like to have more information on this or this presentation or slide, we're happy to see what we can do and to explain it again more. That's what ideas are for, and that's why we make these knowledge products. One last time, if you want to be invited to our next webinars or want to receive the slides, especially if you're not on, for example, the CSAM listserv or G2H2 MMI, send me a message. I will make sure you're on our mailing list and that you'll receive the presentation. And again, you can find everything on our knowledge platform, www.wemosresources.org. So thank you very much for being here today. Very nice to see such a big crowd from all over the world, and great to have a discussion on this about watchdogs, the involvement of the private sector, loans. I think it's very important to have this discussion. And thank you, Miria, very much for writing the fact sheet in the first place and explaining it to all of us. So thank you. For further questions, anything, feel free to get in touch with us, and have a very nice day today.
Thank you, everybody.
Bye-bye.
Bye. Thank you for joining.
Thanks. Bye.
Thank you.